So we'll move on now to discussing something that I think a lot of M&E practitioners will have thought about in the last year. That is the implications of this shift towards remote M&E and the ethics, challenges and gaps we need to be considering. So we're joined now by Linda Raftery, an independent consultant who focuses on ethical uses of technology and data in international development and humanitarian action. And Linda facilitated our workshop on the ethics, gaps and challenges in remote M&E. We also have with us Sophie Marichal, M&E advisor at Terre de Hommes, who was also part of the learning exchanges on this topic. So thank you both for joining me. Linda, my first question is to you. So what were some of the key ethical considerations to remote data collection for M&E that you came across in your research and in the workshop?
Thanks, Samir, and thanks everybody for joining us today. So in the research and pretty much confirmed during the workshops, we had 5 key areas that came up in terms of ethical issues with remote data gathering and remote M&E. The first one was really around aspects of inclusion, and I see people have brought that up in the Q&A. Are we excluding certain voices? Are we only speaking with more elite members of a community, which tend to be, more well-educated, more male-skewed, and wealthier because they have access to digital tools and communication? So really thinking about inclusion, and not prioritizing those with greater access and greater power in the community. The second area was around safety and well-being of communities and of staff and partners. And so thinking about how are we making sure that we're not compromising health and safety, making sure when we're talking about sensitive topics like violence, gender-based violence, domestic violence, child abuse, child protection issues. A lot of organizations are really moving away from doing any remote questioning about those issues because they're worried that they could put children or women at risk of greater levels of abuse if those topics are addressed over the phone, or if husbands are hearing someone talking about this in the household. So safety and well-being of community members, but also thinking about, are we exposing staff and partners to greater health risks if we're expecting, ourselves to be sort of safe and protected, and we're asking others to go out and do things that we used to do. On the other hand, there's the localization aspect of, it's really great that there's a shift in responsibilities and a greater responsibility at local level, but making sure that we're thinking about, do people have protective equipment? Are we making sure that activities are not bringing people into too close contact? The third aspect is around expectations and trust. And so we heard a lot that if we're reaching out to people for M&E purposes, they don't really know the difference between the M&E team and the child protection team and the other teams. And so really making sure that that we're not raising expectations, that we're going to provide some support to community members if we're really not prepared to do that. And so really, being careful about the ways that we do outreach, the number of times that we do outreach, that we're not raising expectations. And then when we do that outreach, making sure we're signposting. So what I mean by that is, let's say we're doing M&E on an agricultural project, but people are bringing up child protection issues or hunger issues or other issues. How are we signposting them to other places that they could get support if we're doing M&E, but there are other organizations that are able to provide support? The third area that I'll talk a little bit about is in terms of data quality and data protection. So we want to make sure that, that if we're going to be doing M&E and if we have these issues of inclusion, is the data that we're getting back high quality enough to make it worth continuing with the M&E, or are we getting such low quality data because of the inclusion issues that it's not worth doing at this time? And so how do we figure out the data quality issues? And we're going to talk a little bit about data protection, I think, in the next part. So that's it for me: inclusion, safety and well-being, community expectations and trust, data quality, and data protection were really the 5 top things that we came across.
Thank you, Linda. And Sophie, how have you approached remote data collection during COVID and working with vulnerable groups such as children?
Thank you. I would say that the first element that has informed our decision to involve children in remote data collection is to balance the risk perspective with the right-based approach. So children have the right to raise their voice, the right to be heard, and their opinion and experience should be acted upon. Then, of course, we must analyze the risks around safety, inclusion, well-being, but ideally with them and their caregivers, because they are the best experts on their lives. And then it was important to consider the objective of the data collection and its relevance. And from our perspective, it could not be just for generating evidence or be only for knowledge production and consumption, but it should also contribute to serve the objective of our project, which could be improving the well-being of children, their self and collective agency, empowerment, or during the pandemic, fighting against isolation and building connectedness. So it means we have to shift the way we design our projects, and ethical or right-based participation can hardly take place in a project that is not already focusing on child empowerment. Another point was the additional layer of complexity linked with digitalization, managing technology that brings new and complex risks around e-safety, privacy, data protection, for example. So data collection using technology should involve raising the digital literacy skills of participants, the children, caregivers, but also the staff. And finally, what we've learned is that data collection should not be conducted 100% remotely. If I take the example of the COVID-19 project, which is a wide child-led research around the experience of children during COVID, the children were mobilized through partners organization and supported by adults allies throughout the process. This is key actually to ensure that we do not further exclude children who do not have access to the digital world. Example, the children in detention centers participated in the survey accompanied by social worker. So if we want to be successful in engaging vulnerable groups in building trust, we need proximity. And we've learned that we cannot fully replace face-to-face relationships. So I would say that M&E relying fully on remote modalities cannot be today inclusive. Yeah, over to you.
Thank you, Sophie. And what has, how have you approached data protection? Has there been any impact of COVID-19 on M&E data protection?
It has certainly had a big impact, and maybe data protection has been compromised globally because we had all to act urgently, while institutional direction were not always in place. So on the other hand, there has been much learning around the subject. I've seen lots of debates and hopefully progress around the issue of data protection, risks, data minimization, safety of digital solutions to communicate or collect data, but maybe less around data storage and destruction eventually. A major challenge I see in terms of data protection, but also protection of people, is about managing informed consent in practice, as the traditional issues that we always face are also magnified when we work remotely. And for example, how to ensure that the person understands is giving a consent freely, how we can ensure privacy and confidentiality conditions, how do we make sure that the person is not giving consent for fear of not receiving a service, which would be a fake choice actually. And when we work remotely, it's more challenging to use informed consent as a genuine step for establishing contact and trust. And there is a risk that we proceed mechanically and that informed consent is limited to a tick the box or bureaucratic exercise. So we have to find a more creative and nicer way to explain the objectives of our work and how data will be used. And during the workshop, participants said that the organization is testing an app to facilitate the informed consent process, make it more didactic, engaging, and enjoyable. So not only a form that needs to be signed. So we could also use video recording, games, but even better, see the informed consent process as a necessary discussion, as an interaction and joint analysis of risks and opportunities, as an iterative process and not one-off events, which means in turns more time and more preparation for data collection. And last question is about the control we can have on the data collected, especially when working with digital tools. Can we really be sure that we have the absolute control over the data we collect? And when we erase data, is it completely gone? So can we proceed to get truly informed consent if we're not fully sure about the destiny of the data and the metadata we collect and how it can be used by third parties? So my feeling is that as humanitarian workers, we need to be better equipped to understand the challenges, the risks in terms of data protection while working remotely and how to manage those risks.
Thank you, Sophie. Linda, is there anything further around M&E data privacy and security that you came across in your research?
Sure. I think one of the other, in addition to informed consent that Sophie mentioned, one of the other key challenges is around understanding inclusion through data. And so if we're trying to shorten our survey so that we're not overburdening people. Two, we want to understand if we are including people and we're including the most vulnerable, we might want to collect more demographic data that identifies, are people living with disabilities included, are women included, are the most, marginalized people within the community being included. We would be tempted to collect very sensitive data. At the same time, we need to shorten our survey, so we might cut that data out. At the same time, we know that that data has more risk attached to it because it's quite sensitive. So there are really some difficult decisions that we need to be making as we design our data collection. In order to both keep people protected, keep their data protected, but also understand these issues of inclusion. So I think one of the really key things we found in the research and in the workshops were this really kind of interrelatedness of these different ethical challenges and the tensions between them were being really pushed by some donors to have more of an accountability emphasis, which then reduces trust. So they're just really interesting kind of interplays between these. I think data minimization is, really a critical piece of it going forward, and figuring out how we can address some of these challenges if we're going to have to continue to go remote for the most part.
Thank you, Linda. And very briefly, do you think remote M&E is here to stay?
From what I'm hearing from people, I think it's going to have to be a hybrid. I think right now it's kind of a stopgap method. I think it's something we're relying on out of necessity. But it seems like both communities seem to prefer having more face-to-face time with people. And I think also one of the big challenges that came up a lot was this kind of lack of contextual awareness when you're going completely remote. So you really have no idea if the data that you're getting and the perspectives that you're getting are relevant, because you can't see the wider context. You can't, try to find people who you weren't planning to talk to. You can't kind of walk around and see things. So I think, I think there will be lots of digital tools being used for M&E, but I think those will be complemented or supported, or vice versa by face-to-face methods.
Thank you, Linda. And thank you both for your reflection. It's been really interesting to get your perspectives on the ethical considerations for remote data collection.